Hello folks, welcome. Today we'll be talking about the differences between neonatal jittiness and seizures, and I would like to explain how you can differentiate between these two entities in a very easy to understand format which you can apply in your clinical practice. Now I think the best way to explain the differences between these two entities is to go through a clinical example. So I will run through this clinical example and then I will go on to explain the differences between the two. So let's start with this example. A 3 days old baby is brought to the hospital because his mom has noticed repeated shakiness of his legs and arms since last night. So there is a short history of shakiness of the lower limbs and arms. She has even video recorded these shaky movements. Now, this baby was born via a planned cesarean section. He was full term, but the mom had been suffering from gestational diabetes. Now, the birth process, the cesarean section itself was uneventful, but this baby developed respiratory distress shortly after birth, and he was kept in neonatal intensive care for a day, and he was also given benzyl penicillin and gentamicin intravenously for suspected sepsis, neonatal sepsis, but that was stopped later because the blood cultures came out to be negative and his blood results were also negative. So he was fine, he was feeding well, he was discharged. Now later on, he started developing develop these shakiness movements. Now at the moment he's feeding well on formula milk, and his observations have absolutely been fine. I mean, his heart rate, respiratory rate, cap refill time, blood pressure, everything has been fine. So you start by doing a heel prick blood gas, and the blood gas shows that his pH is 7.39, sodium is 137, potassium is 3.9, lactate is 1.5, calcium is 1.08 millimoles per liter, glucose is 5 millimoles, and bicarbonate is 24. So these parameters are pretty much normal. So what you do, you decide to observe this baby for some time, and while you are observing him, you notice that there have been a few episodes of fine rapid tremors of both of his legs, which last for 2 to 3 seconds and then they disappear. So now the question is, are these movements jitteriness or neonatal seizures? How to differentiate between these two? So for that, you need to understand what is neonatal jitteriness and what are neonatal seizures, and how are these two differentiated from one another. So moving on, jitteriness, basically, how do we define? So jitteriness are rapid, sustained, tremulous movements. So these are what? Rapid, sustained, tremulous movements of the limbs. It could be one limb, it could be both limbs, or it could be all the limbs. So rapid, so they occur very rapidly. They are sustained and they are tremulous. They are fine tremors like movements. They are fine tremors like this. Shaky movements, like very fine shaky movements. Rapid, and they are acting very rapidly, and they are sustained, like they occur till it stops on its own, or whether you stop it by applying a little bit of pressure or flexion of the limb. On the other hand, seizures are involuntary, coarse, jerky movements. So these are involuntary because they are not in control of the baby. They are happening because of abnormal neuronal discharge. They are coarse. They are not very fine like this. They are coarse, like this, coarse movements. And they are jerky. So they occur in jerks like this, while the jitteriness is more of a tremors like this. Like this. Now, two important differences between jitteriness and seizures. Remember these two S's: stimulation and stopping. Jitteriness can be stimulated as well as stopped. Seizures cannot be stimulated, cannot be stopped because they are involuntary. What does that mean? If a child has neonatal jitteriness, it can be stimulated. So if you gently stroke the limbs, repeatedly, you can see that with your repeated stimulation, you can invoke these Jittiness attacks. So like for example, if you stroke the sole of the baby's foot or something repeatedly, you will see that suddenly the tremors, they start lasting for a few seconds and then they stop. So they can be stimulated. Similarly, if it is happening and you gently flex the affected limb, so if they are happening and you gently flex, you can see that you can stop that. So Jittiness can be started, can be stopped. In seizures, you can't do that. So stimulus sensitive Jittiness can be started by a stimulation and they can be stopped by a passive flexion or gentle grasp of the affected limb. You can't do that in case of seizures. They cannot be started, and once if they are started, you cannot stop them with passive flexion. Remember, because they are happening because of involuntary neuronal discharge. So you can't do that. Then, rhythmicity. Neonatal Jittiness are fine tremulous movements. So they are like this. Seizures, on the other hand, they are coarse movements, so they've got a fast and a slow component. So they would be having like this: fast and then slow, fast and then slow. So fast movement, like let's say fast extension, then slow flexion, fast extension, then slow, like this. Repeated, fast and slow movement. While tremular are like this. So they've got rhythmic oscillations in case of jitteriness, fine tremor-like movements, while in case of seizures, they have got a fast and a slow component. They are always coarse, jerky movements. Another very important differentiation between the two is the autonomic phenomena. Seizures always have autonomic changes associated with them. So for example, if a baby has got seizures and let's say you attach him to the monitor, so what you will see that there would be a change in the heart rate. So either the heart rate would increase or decrease. The respirations might increase or might decrease or might totally stop. And the third thing is the saturations would drop. So these autonomic phenomena, they always happen in case of seizures. They never happen in case of jitteriness. So remember, there is no autonomic disturbances in case of jitteriness, while there would always be some form of autonomic changes in case of seizures. Then another important differentiation point between the two, though that doesn't happen in almost every case, but sometimes it can happen, is the abnormal gaze or eye movements. So in jitteriness, most of the time there are no abnormal eye gaze movements. In seizures, most of the time there would be some form of eye gaze, like fixed eye gaze or deviated eye gaze or eye movements as well. But remember, the most important things between the factors between the two is number one, autonomic phenomena. So if the baby is attached to the monitor, you will see seizures are associated with changes in heart rate, respiratory rate, and saturations. Jitteriness, never. And the other thing is that they are fine movements. Seizures are coarse movement. Jitteriness can be started, can be stopped. You can't do that in case of seizures. So these are the important clinical differentiating points between these two entities, that is jitteriness and seizures. I will show you a video and I will comment on it as we see that video, and that would explain the differences between neonatal jitteriness and seizures. So this first video that I'm going to show you, you can see that this baby has got neonatal jitteriness. Why? Because he's got rapid, shaking of his right lower limb and to some extent left lower limb as well. So if the baby is stimulated, they are gently trying to stimulate the baby, and then you will see that all of a sudden, yes, he starts having rapid, sustained, jerky movements of his right lower limb and maybe of the right upper limb as well, and that was jitteriness. Here again, you can see this baby has got slight shaking of his left lower leg, mostly rapid, sustained, tremulous movements. This is neonatal jitteriness. Again, now to some extent, right was also involved. See, this is neonatal jitteriness, and now I will show you how the seizures they look like. I mean, this is still jitteriness. Yes, here you can see seizures, subtle seizures, smacking movements, repeated movements of the mouth, and you can see it associated with drop in the saturation rate. The sats are dropping, and he's got smacking movements of the lips. So these are known as subtle seizures. Remember, in neonates, most of the seizures are subtle seizures. They would be smacking movements or like making movements just like if they are swimming or cycling or paddling. So these types of movements, abnormal movements, are basically seizures, subtle seizures. So you can see that the baby had repeated smacking movements of the lips, and that was associated with autonomic phenomena, that was associated with drop in the saturation rate. So that type of movement is actually a seizure. So this looks very subtle. This is no jerkiness of the limbs, but there was like repeated smacking movements of the limbs, but it was associated with drop in the saturations, or in other words, associated with autonomic phenomena. So that is seizures. And in babies, most of the seizures, like in neonates, most of the seizures are subtle seizures. So that is how you will differentiate between jitteriness and neonatal seizures. Now, coming down to the causes, what causes neonatal jitteriness and what causes neonatal seizures? The causes are many, but let me make it simple for you. Remember, if for case of neonatal jitteriness, remember 3H and 1D. As far as the most important causes are concerned, 3H and 1D. What are those 3H's? Hypoglycemia, hypocalcemia, hypomagnesemia. So these are hypos, like decrease in the level of blood glucose, blood calcium, and blood magnesium. Glucose and calcium are more important than magnesium. Magnesium, like low quantities of magnesium, is a bit rare. Hypoglycemia, in the case that we studied earlier, that baby was born to a diabetic mother. So there are more chances that these babies can have symptomatic hypoglycemia. Now remember, the most common clinical manifestation of hypoglycemia is apnea. Remember, from exam point of view, if somebody asks you, if a baby has got hypoglycemia, what is the most common symptom that they might have? Remember, that is apnea. That is not jitteriness, but jitteriness is one of the symptoms of hypoglycemia. Not that common, but again, it can be a symptom of hypoglycemia, especially if the mother was diabetic. In this particular case, his blood sugar was fine, so he was not hypoglycemic. So jitteriness can be caused by hypoglycemia. It can be caused by hypocalcemia. So decreased levels of calciums, remember, they can also have jitteriness. Low levels of magnesium, they can also have jitteriness. And another important factor is drug withdrawal, the D drug withdrawal. So if the mom has been on some form of medication, especially narcotic analgesics, so if the mom was taking it during the time of pregnancy, so the baby was also getting those medications and he became dependent on that. So after birth, he's not more on those medications because he's no more dependent on the placental blood supply. So what happens? That leads to symptoms of drug withdrawal. And the important signs and symptoms of drug withdrawal in neonate are jitteriness and irritability. So if these two things are present and mom has got a history of drug intake, think of drug withdrawal. So 3H and 1D, hypoglycemia, hypocalcemia, hypomagnesemia, and drug withdrawal. As far as the neonatal seizures are concerned, remember 2H and 3M. Again, the list is quite an exhaustive one, but remember, for exam point of view, 2H's and 3M. What are those 2H's? Hypoxia and hemorrhage. And what are those 3M's? Malformations, metabolic disorders, and meningoencephalitis. Hypoxia is by and large the most common cause of neonatal seizures. So hypoxic ischemic encephalopathy because of birth asphyxia can lead to neonatal seizures. The other important is hemorrhage inside the brain. Intraventricular or periventricular hemorrhage, again because of birth asphyxia or because of any reason, can lead to neonatal seizures. Number 3 are malformations, brain malformations, anatomical malformations. That could be because of structural brain abnormalities, or because of some associated syndromes or chromosomal disorders or genetic disorders that can lead to neonatal seizures. Then metabolic disorders. Now, this is a big field. Metabolic disorders, including inborn errors of metabolism. Remember, the list is quite a big one, but some of the metabolic problems can present with inborn errors of some of the metabolic disorders can present with neonatal seizures, and most of these cases would have low blood glucose, might be having high lactate levels, and might be acidotic or alkalotic depending on the enzymatic problem that they have. And last but not the least infection. So infection of the brain or of the coverings of the brain, the meninges, which is known as meningoencephalitis or meningitis or encephalitis, that can also cause neonatal seizures. So remember 2 H's, hypoxia and hemorrhage, and 3 M's, malformation, metabolic, and meningoencephalitis as important causes of neonatal seizures. So just to summarize all this thing, remember jitteriness and seizures are closely associated with one another as far as their appearance is concerned. But remember, jitteriness can always be stimulated, can always be stopped. Seizures, you cannot do that. In case of seizures, there is always some form of autonomic disturbances. That never happens in case of jitteriness. So that is how you can differentiate between jitteriness and neonatal seizures. So I hope you have liked this lecture. So do give me a like if you have liked it. Please share it with your friends. And if you haven't subscribed to my channel, please do subscribe and hit that bell. So whenever I upload a new video, you're always on board with me. If you still have got any questions, put it down in the comment section below and I will answer that. Have a very good day. Take care and bye-bye.